Hi, my name is Roberto Martinez. I'm a postgraduate Year 2 internal medicine resident at Tecnológico de Monterrey, Escuela de Medicina y Ciencias de la Salud, in Monterrey, Mexico. Today, we're going to discuss the case of a young man whose jejunal gastrointestinal stromal tumor presented as a life-threatening gastrointestinal hemorrhage. CPP, a 34 years old man, was admitted on June the 12th of 2020, 4 hours after the onset of acute unstable low gastrointestinal bleeding along impaired mental status. Medical history was only positive for mild alcohol consumption, frequent use of NSAIDs due to non-specific aches, obesity, and dyslipidemia. We graded his lower gastrointestinal bleeding as unstable, as signposted by a shock index of 1.7. He also fulfilled American College of Surgeons Committee on Trauma criteria for a type 4 hemorrhagic shock with severe anemia. He was intubated to protect his airway, and he needed a strict close monitoring at the intensive care unit given his 4 out of 5 points on bleed score. He required a massive transfusion protocol and thus received 12 blood units paired with 12 fresh frozen plasma units. He also had 1 gram of calcium gluconate per each 4 blood units. Initial abdominal vascular CT suggested a gut-adjacent tumor of 2 centimeters of diameter, as shown in Figure 1. Further upper and lower gastrointestinal endoscopy proved active luminal bleeding, but there was not any occupying tumor. Arteriography with embolization was attempted at first, though his mean arterial pressure worsened to 55 millimeters of mercury. Thereby, he had an open exploratory laparotomy with proximal jejunal resection and duodenojejunal anastomosis instead. Macroscopic anatomopathological analysis identified a 2 to 3 centimeters wide tumor as shown in Figure 2, containing a lesioned intermediate-sized artery that opened into his jejunal lumen. Macroscopic analysis identified it was a low-grade gastrointestinal stromal tumor of fusiform pattern with an immunochemistry remarkable for c-KIT positive, DOG1 positive, AML positive on isolated cells, and a Ki-67 below 10%, as shown in Figure 3. This case describes an uncommon life-threatening gastrointestinal tumor presentation, whereby an intestinal intermediate-sized artery was lesioned and bled into jejunal lumen.